There was an article in the BBC last week around the mental health crisis among children, saying that actually key to solving this crisis or addressing this crisis is developing resilience in our young children, teaching resilience to our young children. And of course, I'm all about this. I think resilience is hugely important. It's a skill that can be taught. It's not something that's just a natural thing. You learn it, you practice it, and it's an ongoing work in progress. But a word of caution, whenever talking about a mental health crisis, let's not lose sight of the fact that generally the reasons for any kind of mental health crisis are complex and varied. We see the same thing with men's mental health. If only men would talk a bit more, is the usual one. Maybe just need to get men to open up a bit more and sort of move beyond their stereotypes. But of course, the men's mental health crisis is so much more complicated than this, just as the crisis is among young children. Declining birth rates, so you're less likely to have the number of siblings that you may have done 50 or 60 years ago. In terms of your social skills, there's an impact. The impact of austerity, the legacy of COVID, both parents generally working, immediacy culture, social media. There's so many things that contribute to the crisis that we now face with our children and their mental health. Resilience is one of them, but let's not lose sight of the other factors as well.